So armed with my secret cameras and recordings, we walk through the hospital's corridors to the main laboratory area.
You're satisfied. The family demands and basic job is too different.
At the laboratory, a twist of events happen. The laboratory technician suspects my request, then decides to put me through the process of testing for me to obtain a real PCR certificate for him to be safer.
Atachukua sample alafu ya kufanyia process. Ndio tumuuliza mbona mfanye kama alichukua sample tunataka.
Mimi hata si lazima ni alichukue sample. Si lazima. Nilikuwa nataka tu inaisha.
Inaisha ni ni lazima kuchukulia sample. For safety ya hospitali. Ndio nitolee hospitali mingi sana license. Walitolea hospitali mingi license. Haigeti. Kwa sababu ya ku project zao. Sasa kukuja ground kuleta sample kwa kupata. Haigeti. Hasa kwa hii region yote Nyanza region ibaki itagaje. Transfer. Hii region ya Kiswahili ibaki transfer na nini hizo zote zinaifanya.
So nichukue size sample?
Unachukua sample na mshika 50. Ndio. Kwa kesho jioni ukienda huko kila kitu iko sawa.
Anichukulie tu sample hapa. And then travel by the time nafika huko
sawa.
Estimate but within 3 months, 2 months.
Sema ni December.
Yes.
Hakuna hata message kwa simu yako.
Naambiwa systems zilikuwa na shida, so hakuna venye.
Kuna mahali hizi vitu.
After few tests and interrogations are done, I'm directed to get back to our operation area, which in this case was our car, for payments.
Kwa nini? Tunashindwa bora mmekaa. Sasa sisi tumemaliza. Na kuna jamaa anamweka bampa.
Kuna jamaa anampigia anafuata yule anaona.
Kuna jamaa anamweka bampa. It was 35. Amekupea ngapi bro?
Hiyo
ilikuwa na shot. Ilikuwa ngapi?
Ilikuwa 35 kwanza. Ya ule jamaa 1. Ule matu. Alafu ya ule 2. Ndio hii plus jamaa 1. Inakuja 45. 45 plus 2 65.
So hiyo ni kwanza 5. Hiyo ni ile ya
5. Ni 35 ni
35. Sasa ule jamaa moja
1. Lab 2.
Alafu huyo lab 2.
Jamaa nikataka kutoka. Nje tena ambapo jamaa akachukua sample kwa sababu he doubted the way he doubted.
Kuna 1. Unaonaje? Tumpe hii alafu tumtumie sawa. Sasa tumtumie sawa kwa sasa. Ndio. Mama.
Ibini tumia hata jamaa aje msumbua.
Sasa
acha nikupatie tunaambia jamaa.
Yo jamaa. sawa.
Thanks.
Nice doing business with you.
Lakini mkienda huko bana, nipatie namba.
We leave Kitale District Hospital with a COVID vaccination certificate without receiving a Johnson & Johnson vaccination jab, but wait to receive a legit COVID PCR certificate after paying for the service. As we contemplate on our next move, we receive information from our sources that a family is in pain and bitterness after the father, a Samuel Katam, allegedly contacted COVID-19, died and buried immediately according to regulations put by the Ministry of Health. So we set to find out if indeed this was COVID-19 case. In the village of Kapomboi, Kwanza constituency, Trans Nzoia County, we meet the late Samuel's son and his mother going about morning duties. After our introduction, revelations from the family of the demise of their father are shocking.
Sasa chenye tulifunga kuelewa, walitukuja wakatusumbua kwa mazishi. Kuna kuona mwili. Mimi kama ingekuwa COVID, mimi nilikuwa namjekirua. Kumpangusia jasho, nilikuwa napangusia na antakiti yake, nilipangusia kaloa, nikatoa yangu nikampangusia. Sikuwa nasema COVID inatransmitiwa na body contact. Then ningetakana nikuwa na. Kwa since vile alikonjeka tu nilikuwa naye. Kumbadilishia nguo nilikuwa nambadilisha. Furthermore hapa tu okay, wanasema mimi ni strong, bado niko young. Tuko na gogo hapa over 80 years. Alikuwa na yeye throughout before hata aende hospitali. Akiamka asubuhi anakutana na gogo anasalimia. Sasa jenye si tuliona hii story ya kusema ati hiyo COVID ilikuwa biashara, ni kama ni biashara tu. Sijui hao barafia wanalipwa wakicontact mazishi kama ile.
The family claims that it was not COVID-19 that killed their father, but allegations of a vaccine jab.
Mimi siwezi, okay, for example, acha niongelee hii chanjo, hii vaccine. Since mzaa chanjo, hakuna mtu ataniconvince atiende chanjo. Hiyo ni kitu ya kwanza. Na mimi maybe chenye naweza ambia tu wananchi, mtu asikulazimishe atienda chanjo.
Yenye iliua mzee ni hiyo sindani ya COVID. Na labda hiyo sindani haikutaka hii matibabu ingine, ikaleta complications mingi kwa mwili. Tukufanyiwa haki. Sababu alituambia mzee amekufa COVID, na wakatuambia mkitaka kuona mwili muende huko. Hakuna kuangalia mwili huko. Sasa wenye tulienda huko tuliangalia mwili, wenye walibaki huko hawakuona mwili. Na hiyo mwili hawakuweka hiyo karatasi yao vile wanasemanga. Na hakuna ripoti yoyote yenye daktari alituandikia ni COVID. Alisema damu ilikanda kwa mwili. Na damu kukanda kwa mwili si hiyo sindani. Na angethibitisha kweli ni hiyo sindani ni corona. With these revelations, we again set another challenge to the Ministry of Health, and this one blew our minds.
Now, this is a grave of Samuel Kirwa Katam. Kirwa was buried after it was alleged that he had contracted COVID-19, and therefore, within no time, he was buried. With me, I have his death certificate to justify that indeed Katam was buried here. Now we want to interrogate the systems, that is the health systems that provides COVID-19 certificates. We will use his details to find out if indeed a certificate of Samuel Kirwa Katam will come with a negative results. This result trickles all the way to WHO real time.
This time round, armed with a death certificate and other documents, we come back to Nairobi to see if we could obtain a travel COVID-19 PCR certificate from a reputable hospital. Hey kaka, vipi? This is Francis, a quick one. I hope unanikumbuka. So we are ready. We are supposed to travel. Ile mambo ya ama nini, Nairobi West ndio ninangoja. Uliongea naye? We are traveling on we are supposed to go on Sunday this week, yes, a day after tomorrow. 6,000. Hey, haiwezi punguza. Okay, so ni nani unatupatia, wa AA ama Nairobi West? Kemri ya Kericho. Aha. So tufanye hivi. Hebu nikutumie details ama unanitumia namba yao jamaa?
So we get back to our target, and this time round we target another laboratory from a different county, and this county is Kericho County. Kemri Laboratory is introduced. So yeye anataka pesa ngapi?
Anataka nini kwanza vituma 6 ndo akiendelea kuprocess.
Tutume nusu. That is 6,000.
Yeah.
And then hiyo nusu tunapata saa ngapi? The rest of the job tunaipata saa ngapi?
5, ameniambia by 5.
By 5
Yeah.
Sawa. Natuma wapi?
Nitumie tu hapa nimforwardie.
Sawa.
After a week of waiting, we successfully obtained another trusted travel COVID-19 certificate through a phone. Details of Samuel Kirwa Katam are now revived, and Katam is alive. So Katam's certificate is successful, and the certificate under traveler code PA 3985642701 with trusted travel test code indicating LT 46079128 is produced for Katam from Kemri Laboratory in Kericho County. From our findings, we realized that this certificate is trusted by Panabios organization, and all access is from this organization or CDC and African Union. Straight News can confidently report that data collected from Ministry of Health on both COVID-19 vaccination certificate and PCR certificate might need re-examination according to our investigations. We also traveled to Kajiado County, Namanga Health Facility, located at the Kenya-Tanzania border, if we could obtain another COVID certificate, but luckily, we never received any document, either a PCR of COVID-19 test or vaccination COVID certificate from this facility. So how do the COVID-19 PCR testing process takes place, and which areas could be having gaps that has led to data inconsistencies in regards to real tests done in Kenya?
When it is put here, that splint is cut and it is left the cotton swab plus the half of the stick is left inside, whereby it is the one that is used to pick, and then we have already the material from the patient inside the transport the virus transport media.
So what are the legal implications of such issues witnessed?
Look at forgery, if you look at the penal code, yeah, forgery is a crime. Yeah, so you just look at the penal code. Actually, it doesn't have to be generated through computer or anything. You just look at the penal code and you look at the crime of forgery. Yeah.
Now, let me give you a specific case here. There's a story of a laboratory expert in a government-accredited facility, health facility in Kenya, issuing out a COVID certificate. So that under penal code, how do we?
That's a counterfeit. I mean, when you look at the penal one, it's forgery because it's the making of a false document to defraud or to deceive or you see.
No, but this document comes from the government system.
But it is a false document, my friend. Right?
Okay.
Because it does not provide the authentic information about somebody's COVID status, correct?
Correct.
Which means it is a false
document.
A
false document generated in a government accredited system.
It doesn't matter whether it's in a government or non-government. When you look at just go to the penal code and look for the provision on making of false documents. It doesn't matter whether you do it in a computer system or not. But the fact that the document tries to misrepresent facts or states what is not factual, then it is a false document.
Data pundits say that data is crucial in any economy. Numbers, especially in the health sector, informs many aspects including budgeting and donor funding. It is time Ministry of Health interrogates its data to ascertain real numbers of people who actually went through COVID PCR and vaccination testing.
All eligible unvaccinated travelers arriving at any port of entry into Kenya must have a negative PCR test result conducted not more than 72 hours before departure, regardless of the route of entry.
We sought to table our finding to Machakos, Kitale and Kemri Walter in Kericho for their comments in regards to irregularities witnessed during our investigations.
Now, we are at the Machakos County Health Office to present our case on our findings to see if indeed they understand and what is their response. So we have just arrived to see and talk to the head of this facility, that is the chief officer of this facility, if indeed he will respond to our allegations, our findings, or not. If this certificate is authentic, is this certificate authentic? Would you say that this certificate is real?
You see, now I have to pass it through our system so that we can get it right whether it is true or not. So just at the face value of looking at it, you cannot tell.
Okay.
You see even in the fake money, the currency, they look like money, they look like real money, and you have to pass them through a process. You have to check and have the codes and confirm with the features of real money. So the face value of it, as it appears, I cannot tell because I have to subject it to some level of information.
There is someone called Abednego Mwangi. Are you aware of
The Nego Mwangi? Well, yeah.
Who is he?
He's one of us, of course. He's working within the department.
That is the department of laboratory.
Yeah.
Because I can see him only here.
Yeah. Yes, he works.
That shows that he's your real employee.
Yeah, that's a real employee of Machakos County. An officer working in the laboratory department.
Yes. So maybe tell us if the data is authentic or not.
What I said, our data that we do have in our system is real time. You get a job, the clerk is there, keys in your details immediately, and you walk home. You check in the system, you find it is updated. Yes.
PCR?
By the time we were compiling this report, our efforts to contact Trans Nzoia County Health CEC, Kemri Kericho Laboratory Head, and the Ministry of Health Cabinet Secretary for the last 1 month were futile. According to COVID-19 resource tracking, a cumulative amount of funds mobilized for COVID-19 at national level stands at 459.1 billion shillings. Of this amount, 194.6 billion shillings are loans, grants and donations. 130 billion shillings coming from the National Treasury disbursed. 1.3 billion shillings coming from supplementary budget for fiscal year 2019-2020 from the Ministry of Health. 1.1 billion shillings coming from Controller of Budget Special Implementation Report on COVID-19 at counties. 2.6 billion shillings emerging from COVID-19 Emergency Response Fund Board and 104.5 billion shillings coming from annual budget for 2020-2021 fiscal year. Though it's not clear how much out of the 11.5 billion shillings allocated to the Ministry of Health would go directly to dealing with COVID-19 response measures. All these billions mobilized by October 2020. The need to enhance transparency and accountability in management of health services in Kenya has particularly been in sharp focus after media highlighted COVID-19 millionaires expose. Subsequently, this status of affairs continues to highlight the importance of enhanced transparency and accountability measures in health sector.
Now, after several months of our investigations, we managed to secure 8 certificates. Of these 8 certificates, only 1 certificate is legit. The 7 certificates are not legit. Now, this certificate is from Kitale District Hospital. This is where I received my COVID PCR legit certificate after undergoing the relevant procedure. Now, with the 7 other certificates that we managed to get, we got them without any PCR, without any specimen being taken from us to the laboratory. Now, the question begs, does the data that trickles all the way to WHO from Kenyan Ministry of Health legit? Now, we've done our part. Now, we leave it to the relevant authorities to take its course. For Straight News TV and Habari Kibra, I'm Odee Francis.